malungil talyal sis marabeklat. Good afternoon, everyone. Paman sulang al possible may bangget at tial leadership meeting al sils. Ni tarabeklat naman ngaging ilir tomu ora meeting iri al tasils. Wala tomu ora aldo tu sa kon malingit ra Pastor Hendrik Kwal albol mas marila meeting iri al sils lobang lungu.
Ulit marbeklat tal ekle dolulu. Dal de mamal Dios ngarayang ada giom ko dong claim ra elal itasils. Agi mo umul mereng asulem ulang serkau ra klis elab dangam ma osab claim ruba kal milngit tigay mamal mer elal sils. Elal sigang agi tugubet sil mo ulingit ra ong tigay garkau tugubet elal Presidente Belao mar mga taklela balu ang artyang agi mal mo ongit luwase idaring garkau bolo makalom sarang riar ade long tigay igi direkal mo otro kartir may giroguil girel matib matokol giril malbadeb bol sabi elak at gingem almaselarungum almo mga tigay kartir imo terga klitial time ongit luwase awud arkaw direkal bolong tigay imo makngal tangat atial meeting raw alel mo raw lab ngalel mo bol sabi sil niya mo o klungyo alel malubong osab aklalak lang arar adar belaw amo makatmok kon mo waisay elol tirak ramok tagarkaw magi mo mereng asulem el mutul mo terga klitial meeting al imam ulngit mo nga tigay ka ay gaya ong tmam algi ba mo ngit nga kay Jesus ang yang arlos salam. Amen.
Ano sila Pastor Kwal? That time so klo lingit ra His Excellency President Surang Whips Jr. Walbas kita remarks rin al itasils.
Malungil swel itasils. Almora arbeklaaf ngartiang. Ito kubet sa usus rakay raklay marugul belal los ilobangget pilong President ra Senate Hokons Paulus marugul senator sa ngartiang ilobangget Speaker Anastasio marugul delegates Chief Justice Ngiray Galaw Justices Tiregal ngartiang ilobangget relal tuta Vice President marugul ministers musubesang itasils Dire kan mal lungili tasil sen more kami governors, more speakers, marbek la adra belul mnosi lo bangget. Dire kalau kumes to bangget are members of diplomatic corps. Kada man mereng asulir tila amne join lagi dire al sils. Kita mendengel wase ablur belal al time. Asedro wase ngari ase bakring artir ngari atribel الضغط جدا ngartir al silsil leadership rablur belaw lobantir triel tira gumarang kida gira orreng sertir orngasal al el gira la togora covid ak madengel waseng batoga am top dra social media ngartio doctor yanong purgidro ase kabobe ilang morreng sera adana ministry held हमने मुक्तगरा मीटिंग रिगिदर लालचिल सा मिस्टर अबेक अदरा अबलू leadership ng artiang at level loger agere moklo adra rungud madabora abluat edo mergara aisen mara adra ablum bolo ne sengara gel giredel magal mangat moklo sobo leader tial raktel degal sedro sengarak mungir meng oreding obang gedra alchils mungiredel mom dengel wase tiang artiang mungarado itu uriid mungarado sabak kergider tiarak terdengia oreding obangget diregal sogal ngutial te alle diregal mal momrenga sulela a ministry heldergit Dr. Amais, Governor Roberts, tial tokora COVID am lamo erura lobangget. Ya kumara lo asya awale la aureor el mera la alsil sing mal mle mering e continue mering la aureor adra ministra hel. Kumara nga songa sa aliwir di tira utakangal. La aureor leng sabak klela klangara tamatal adra belo. Se angara the swir rabe kaltam ram klela aureor. Ngadamaran mereng asulir la incident commander elal riter udui masel timer gidra IOC marbekal toktang Dr. Mogol kumia ngara front line o mesergida de gong sel dos pe angeso magada gadolin tra supporter arbekal adra balul supporter tire mastira smile tire kaya sel al do masket ra de wasa smile kami over hospital ndi motangal smile adang المورتير بسترير تجيب الموضوع أو يلتقى المورتير لين دولو أيسرا بلور بلا ولا سه كدمو موسم السكول تال ساندي المقتقر موسم السكول وسه تونغلاك لا رتيال مال بقول يول راكت المورتير ألسلا بلور بلا kada madeng aser ngaliget sel ngara oblil mera blai ngara blai mora school eluten mera blai tiga ngara ros oblil matia sel almutel magara klit tial rakt almutel mangal mabko yura blu murture gegit kada molon gitar adra blu ase kame do ngon la school el tal sunday eda bastre adra hospital atribel time lagal salom gu gaidi sirar adal lo batte rakt mal moklol modagal sedro tugur di ngira del dire kalmo omdenge lo ase tial tokora sabaklela tial rakta malubang ngasang angar alet kidar adar belar rogoy ngira del motmak mal mongira muksel kartel al litasil segi segami rogoy lo maska se angar alet tama taladar belaw do maska leng betigarungu dra tama targit saya ulah kau mask, kada merur ser ngar alet, kada aroi dah dorong alet le listing 3 feet, leng bertiga reng awul, oi mal suada kayu kada email asuada hagan diga elang tiri bertamil dah aroi dah, kada dia kalau mal mendengil was ngar alet, mal bal imad, ngar alet le kergik dia kada ngara maklolon dibel, kada ngara maklolon dibel kada make sure kau mask, kada ngarik le malungil atau mask. Lek madengel wase al time ngari arang lihat dan mal misisi abadengir ding ngomili lembat tatmlet makarak munger dia kalau mask mau ulat continue lo liur terrakta mang ngara lihat rogui mau kerjik lo tirak lagi lo logoy a ministry health dergit mang waise gide dire kal sogal waise lo ase kita diri mal ngal tangat, leng mal betok diri lagi del salid, especially blura Amerika, blura Taiwan, blura Siabal, blura Australia, tira, Michael betok blura blada, amal mol malong ngasih orgit sel bodosi seberai lagi del, rengalela aureor, mang dimle ngawal aureor, etirgal tim, blura Amerika CDC lagi ler dari belau. Kami adim dengan lihat Dr. Bostrom, Dr. Thane, material adra asper, tira blo all merbelau sel serapa dolar orus etamle, seral hotel ngaria first case etamle. Ya gumara lo asese o tisel mesel del willer gid, maklain ngaseur adrong olet. Mabel tiger rengal igal blul mergid. El samreal on ngaseur gid sel bornia amatar basul malu meringal mergid. Mang kadang-kadang asa sulle la blur Amerikel dia kadilol durok ra vaksin el mei mangeswel bek patengas maraf di suadlo aiser el alsils lo ase kadidire gal lo sabe del ngada dur tigal salid ablur Amerikel lo ase agi mol mol ngaseu matrigam lame ngari te al al mutel bebirar adal men ngaseu orgid mal mutel gele suadlo tora test kit ngari al mutel te ar gel me dire gal lo sisil time em lo ni atel adal confirm lo mangela ambassador at Taiwan al tutaw lo se sales kogir nga Taiwan almera ila almel sabadong amo ultaga 10,000 test kits madiregal ngare imol toktang gel expert in infectious diseases diregal ngari imol nurse ma imol adralab tigamel mo help para masabak ra hospital gid mang akora di mo duritelo seguida brangal tangat trigal salid di gida ko trungila igalo sulat tinga dar adar belong ako meser gidre al sil se kada mal di waigan masuku sel sum kada mral ngara al mol lo siga galet di sel laboringa auldigel kada motmak e kasapak e se dos peril al tamakmal marenga suli rogui no se dan arterial al sil la dadu lo bentir trigaigidel matgo de adara igalurior emral marenga suli la doctor yano ni ukno de kalsel lo mangedre lang doctor Cuarte doctor Roberts doctor Mogol trigaya toktangal lo no se orgidra abek kalsil imdura aurore e helper gidak marenga sulir selungul sutrir ma beltigre ngatin mora belwadel selwai gaigidel ngani amatar basul etira mosmao dem katakla tokol merigit lastly en disogal mutel dimrenga suli rogui by out the strong partnership that we have with the United States, with Taiwan, with Australia, and with Japan. It's through your support with everything from PPE to vaccines to doctors on the ground to help us get us through this. And I just want to, thank the team from the CDC that's here, Dr. Hancock, Dr. Bostrom, and the team from ASPR, for being here when we need you most. In fact, when you arrived, we were just at the beginning. And now we've had to tell the public that we've reached 100 cases. So you were here at the right time. And we appreciate really the continued support of the United States in these very hard times. And I know that you're here, and maybe more support will be on the way. And we really appreciate all that the United States does and continue to do for the people of Palau and helping us get through this very difficult time. And I was also sharing in Palawan, of course, the great partnership that we have with the the Republic of China, Taiwan. From the beginning, I know Dr. Roberts there from the beginning. I know there's the containers, for example, that are being set up. Unfortunately, they're not ready to run yet, but from the beginning, Taiwan sent, the infectious control box on a fishing boat to Palau. The PCR testing kits to Palau. We've been trying all different kinds of ways to get things done. And I was sharing with everyone that commitment still is strong and it continues. And on Saturday, on the flight that is coming from Taipei, Ambassador has told me that there will be 10,000 test kits arriving on that flight. There will also be infectious disease doctor, a nurse, and a laboratory tech person to help support the hospital, because that's really what we need at this very important time. So thank you, Ambassador, for sharing that with us. And our friends from Australia and Japan, thank you for all the support from the beginning of the pandemic till now. We would not be where we are without that support. So it really requires all of us to work together, and that partnership not only extends outside Palau, but it also extends inside Palau to every citizen being responsible to do their part, and that is to wear masks, to distance. And today, it's good to see everyone in mask today. I know when you go around, you see people in mask. We, as citizens, need to do our responsibilities. We close the schools to stop the surge for a week, to try to contain and control the spread of the disease. We will continue to take actions, and we ask the community, to listen to our ministry and their guidance as we get through this pandemic. And as Dr. Yano would say, stop listening to social media and the other experts. These are the experts here today to share with us what are the best practices and how to best move forward. So thank you. Minister, I'll give it to you.
Mr. President. Laltay man sa akong malingit tra tangakal Senator Hocons Paules, President tra Senate, ukol baskida aldada alil alita sils.
Alle kultur gerak lah doktor bolswit tirgal kali gerang akal meskakal wasyak ngerti alo kontrir. Balungil li tasil sel mergid rogui. Aku meral wasyak ngertial di tamok tegergid. Kada mertial mosebedel rong street tirgal adara sidi sil tiram naragwam el mei. Bolsebel makluar ngud el sab aklider atleta el belur belar el al sil sangare ungel. Dia kangud el sebeder rulli. Kerdi ultuir tirgai gidel الجيدة أسبيرتيل لوسيس أكليد إنغسو جيد الوسام كذا مغران يابلور بلا مو للاك لكلارنغو لسلب أكل ارتيال تلتال جيدا غرا السيل مكتي مرينا سولي الروغوي المنوسب المي مسيل دورائل يدو بطال تغوي الجيدا نيلور ترغا جيد الأذ ملاك الطوب دي بودو الغونغود التغوي لنيادي ملاك المرال تغوي إذي على المدون اللوغيو ترغا جيد الأذ رسيدي سيل تيرا غرتيان الموصوب دي رايجل نيا جيرد المومد نيا أكتير رجلون نيت ترجيد ما بدو جرا جير تير يدو جرا يجل جير النيا سوب أكليد يلا كدو جرا يجل جير لو سيجرا وشين تادي ملاك اللي ليلا ولا بلور بلا البانر إلى التايم اللي كده عرا تيتوغ التايم دي كده كتون yang kamal mereka sulir rogui.
Misulang President tra Senate. Laltay mo tulog ka tangakal Speaker House sabi no Anastasia ukol baskida aldada.
Reklay, rugul belang susam lamdung mendiabo gumelek. Akto mo katong na butong yang kleme. Lalo dosong ak mo mengudul kita beklad melam sa TV ra alider semlemitra Sira Friday. Maigat tokoy mo kusada melam man adi ka bergula botong melek la. Adi ku lingit ngia asing namo time berdia ka ketut kilo sing tiang mat kentil taang malumeng malungir ne klungyo mortang. Kadwai lurol kirel rurak elang meramang egida selvak lagi lurere rurak. Agil ngesora Taiwan ma Amerigel ma Australia ma siabal amlang oswid men mutrelang. Kada bokor gikla din diakal giredel mo awanay raw sing makarador ng seurar adra blur belaw akti matraka minister elal tutak ne risiba gorra arador ng esar diakal tululoy to ay silo sing ngari atara patient kira bayra mo uang ng esar diakal serious diakal nga ospital di nga para muwang item na kogelo sing arsay sel bolugil en tuob. Say atetere la dor ngoseu. Bulun motmak ti side dor ngoseu rarab. Mundi isolated nga para amuwang ng isar kadra laway sebera la irudar tet mural sel. Ak madgay wasya blur bela to kablay open. Ita kay ngoseu elengalak tiang. Rak terkida rogul ada bela albang lagi. Koman sulang.
Man misulang Speaker. Laltay mo rira call laklay irmang masel kuk mo aldada.
Palugelo dosong Presidente. Tirgal rogul martial motling rablur belaw. Tergal elimos kang martiangal bato rarolela ukurulel tialkar magbiru mariel di kabaw marubol bela o mesra ara ablo waseng wangara bulog at sumar ada abuse paradir e wangara da ngala karabulu beti merte gede sola so alon hitra madra bogata bol bada maru bol bela el to ukel ko ki bonda swaru bol bela un ngala karabulu
Malungil litasil sen morga president marbek ram ngartiang tirgal mga teklela senate marok adal kita ngar el leadership meeting el alswel me kung tibokum teergi del ngartiang kadumral wasing mal koteng gire del merenga sulira pitar adra Ministry of Health and Human Services. Le kadambal aswara avere de la urerir el overworked, overstressed, masong sar adrir, hindi tamalmol mal wagel lamadung maeru rakalo takaortial problem min mutrel al shields. I think we owe it to them express a sincere appreciation regal efforts tir Minister Kafar. Direct el suadal mo otia muy support tergid el girel ay gel ladareng sra recently ra measures el teka government el mo umroba artial el spread artial el rapt gidesel sam okla school e direct lol kabaya ondible di mo kringa mask magirogul giredal ngarngi kada ko ngay luaseng gire del ngoswira kablement el mo stoba igel ngiam lo ulet tiarak tam la sois para blur belaw mung kada mu ra travelers yang outside ang masaras ko gil may kada supporter sel waset tingiril la ang wa vaccine et test negative ang masaras ko gi dice la guerra ra blur belaw kada support sa igidam lamadung recently waseng almug tal moringa a COVID testing ra airport ito mo quarantine tirkalat librak mo hospital la certified wase the negative ru era release til mera a public al motalor gidara ay gang minister Kafara maldolit la sebol sa bedel kumo ligay gidi ang araran rirar at adoreng sa latest report gabiw in 119 cases sa COVID of lam record, 394 al-ada under quarantine. Mung kumla a designated tial was in community spread. Lamo dia kadil ng travelers sa duwarir tir, lamira al-sela, adalang akled, maklibli led, ar other belaw. And that concerns our rotoklaan. Mung Seguido lo hace cameda bodada rogu y de lutel si angera igel lo ule a COVID a merda blu mem da kaing seul beklat el gut makli seguido ko tulugi la ngudel sa tial efforts el moklar ngudel ngil girel awas 95% tra other bela am la vaccinated se atara de algegrel to indirect mal el giredel el upload efforts sa hospital marbiklad el vaccinate ra 95% ra adal gire del vaccinate but the fact remains lo singaria 5% ra population which if you look at the numbers ang amo 1700 tal ada represent ra 500 5% ra el dia vaccinated and we need to be concerned about them tirgel other belaw ngaria precondition tir ngaria raktir ngaria atituol el partra helder tir a direct la aswada bol klar ngud ma klar rir lo ase even though kadam lang matest hindi ko bidal bortir la il selva action likadabal ol simbal wa siya COVID asabel molu trar msisi abadangir and di sel labora am itu tabadangir nga precondition raktir segita asabel lor di raktir. Nagigidal abebir information and Minister Kafar el direct swadal moklar ngudar meng silkiren. Tirgal magkakarel ngal karel al direct diakal dirgal vaccinated. Direct I know I speak for the parents. Direct di tire prohibit taranal girum diakal por hospital. It doesn't take the public health notice and mortir. We need to really get out the facts, my information and mortir galngal ka. Nsiil moklar and dire kada. Kada upload ourselves 1 week mo diaka school kada trial share ay gagid information and more bikladong moklar and dir madalu to resume el self aklar and dir parents marutokla. Ngar alera arbeklade agi nga direct ng artiang join rar beklad am selo kodong wase dia ka dil hospital amo ngar alel tiang kidroguil from the rubkul belao morar senators, delegates, governors, speakers magidal adra blue kada magarang may galungil el practice el maral mo ngara blue marada mo understand lesegi de atara adesar el almo titogla de kadil tora school at tora kameldil at tora ngasa at tora reunions at tora gidilon dibla and said swadal mal mo bekladel madanglia tamatang aledel wasin dia kada help spread out the tial mura community even more. Sel advisor kami kafar rubul belao akmal diolgit wasi ay kada kadil ngara arang mam ngararan dir bekladel kora madaktal malkoy. Ako ting tolalon ngit del roguy. Luase when it comes to the issue health, my economy. Edungwa health tamatal adal mo arbabra at tora gayzay. And maybe help explain and mortira amral berredel ma at transparency ma seriousness tial rakt. Creo saklanga tal adal gidrogwel ako kasi hindi ka millions of dollars sa sabi restore rak lang ara. 1, 2, 3 and tangka hindi ra ka the borsis bersegid. But I think ay gigid ang ara na dirar adal igire da kayong sul beklade sumok lang mo clear. Ang reality real ang talamal la economy ra tora tourism di el sela blur belao actually kadamla salba akla. The construction economy marara al selablu, a retail industries marara al selablu, a government tamlewila program ringil make sure hindi ka adal lay offer tier, ma private sector man direct mirala a business tier loya ka a domestic demand, mutiyay gidra la ka mal abul other belao mel mutrel al sils. All because in dimlaktial community spread. Katabay remeng sa batok masang mal successful result rin. Kamaldi, you name it. Ngwadim lang reflective ra. COVID hindi, without the reroute ra al sel ablua pa mal mleklol. Lemlek ngariya confidence sa ade sel baak. A program ra government to make sure hindi ka adal mo, hindi ka lurior, amlewil. A reality was endim legal shobayar ar adang al blue, el ngarbela ya suffer. Hotel industries, may tourism-related industrial, low spare or other ang blue, ay gigit amral niya no suffer. Iyarbek la other belaw amral dimlan niya ungila, antinyul nga niya ungil urerir, maungil karangir, maungil lomangitel audod, maul mumlesel baak. Itiya nga point for the government. Berang asulela executive, legislative, will continue provide the segi that support them lora. Domestic sector. Di ela ul magadam akildible besaw dengi ay gagidal measures el ang self-level community spread. Imla mo gira the limit at ora school, limit at ora on dibble, limit at ora freedom of movement, limit even agil number askogil mong mo sa elmer bela I hope and continue ling adirek amo de kal sorry fly merbelaw ling al ngari community spread. And then ar adadal los pe a medical referral adirek mo suffer sel po lakas ko bilmi. Minister Kafara ataramat sadal mo duli lingararan di arbulu din dakal bageul misbi illo kerngi awaseng lam mo time direct the test tirigal sbe mira hospital ma armom karyor mo kodal to make sure etial covid adia kalingia contributing factor mo tirigal adal mosbe rebre adal mo re daraktiril mo serious etamat. That's how serious our other elanga umdas will giril tiagid. So we need assurance. We need confidence wase aurere da transparent temralo otia asyasing ertial impact ra COVID. Finally, sel sorira rubul belal moduli support ra hospital reng the sooner kung tial problem ra COVID under control ang mo sabi elaw guru le direct mo pay attention al morar adal direct el ngariya serious retiren din diakal COVID. And I know la dulia Dr. Cuarte, Dr. Roberts, sa ikal mong break lo se hospital ada dito mkarar COVID. Direct malbeto kar ngariya serious retir lo spe a emergency direct el full medical attention malakat al COVID bolu el take away attention from them. Ma public health may gil preventive programs. But the bottom line, el sadal rulir al suelwa, say whatever it is, ludur adra hospital, let's go home after this meeting. The mral ngul mengar aledal share correct, appropriate, mral information, madirect what we need to do as a community. Itang srira ka farmer at hospital gut mukli malakal dulu asit yangar alila hospital malubeng kantil taang. It takes a community to really make sure that tial rakta will go away. Igagida sa sel mo sa mong yung malmisaw tial tial. Thank you.
Ansulang madang bukod. Agi direktal malmering asulem rakuk sera era bomberekal president regel kuk efforts algida di lakal gutmok raw alel tial pandemic mon mut rakuk kal change administration agi direktal malmering asulem sel support sel domesar agenda argite sekal mo maskida kora updates rakuk to kora cases kagida Dr. Makol ngartiang niya director hospital ma clinical services direkal sa mamal terung kuk mo ay sagel bebir telet lauriol potong otmok magiblam mamuul mga otmok ra hospital al malas mal mga sadal ra predel tegi del rakto kita madang buk lo o quote sayel bebir kay kita lo ur eli di bok pas kita update ra kuk di sila guys mon mut ra taklok el alsils taklok ra tasils lay di sila guys mlamadang el alsils men mut ra taklok el al 12 at 23 guys nganya bebil ngara mlamadang ra private clinic rest 12 ngara mildang ra klol hospital sa domestic ng ngara 123 active cases at time. Tira ka adal mo New Ying ang COVID ul. Tira ka 19 namla recovered. So adal makatakilo sa igel case ang matang agirel true klubsel wal tiltil isolate malubo kada isolated til true klubsel sel test kita mo sa edet mula sa tanamo mregar sel kalsela infection til sel time tiram lepo ko yul. Iway gel dilo nga madrang bukod tangaria at least at 394 close contacts. Masel domes ra total lour cases ra blur belaw since ra August 2021 emlamo 142. Direct kalswad lo ay silwa se omasin draigal active cases tiragal 123 case. Adir ka malmol mal suku manganya symptoms tirang mild. O masin tira bay dimla kalol aswal waset infected. Emle close contact me test bay mo madangil waset infected. Direct kal to teleleng segi da direct kal ringlela urele da roguy. Sebela adal dia kalol aswal wasen smer emrail oy walin martaraat. Segi da direct kal ul makdwa se togtakang alo mask roguy. Tolas maldi aroid. Tongoroy tergidra adal smer el sukum ka smer ela kamo mais. Direct kal sadalo ais wase ay gel kalde alim lamok kalde quarantine kuming isolation facility amla mo masekat. Il altay manganiar adal dol durok kortil mora kablirir lolingit tertil sa tadi isolate trablirir. Ma adal me madang al positive ra either ang klol hospital malubang kal private clinic angani amal bring il tokol mortil wase komormei isolate el girel 10 days sa mangira tokoy ra other hospital. Lamo dia kal sa edol takaw ra idisir raat regal isolation facility. O sisilta met tirigel close contact sa madang te direct kal ngaringi at tokoy mortil wase komormei quarantine mangira test. Damadingel waseng di maral moklog tiarak dia ko dumulak waigel dilong tirigal toktang malimis el bugu yuyul. Malimis el bugu yuyul may waigel tilong sa ela adal dia kalol aswar ela infected. Tokuni kidel pelur belaul klora o kail basenta o til basenta mlamrus. Seungil toko inding direct dia kal giredel umakpuyot at tiarak. Direct warinyar adal mon yuying. Giredel makataklisel wasem warinyar adal mon yuying. El anganyar adal mo madat tel COVID. Gira kal duli sel minister ahead le sukumung dub endia kal gira dalo. Magi mo regel kurbabel sa mamaluguk. Sa okrat teletal ba da sisper alsen ding sa gidi. Kadam larmeng sa tirigal toktang lo sa oy nganiyar adal amon yuing direct kal nganiyat te elir adal mo madara COVID. Mang yakal sadalo makpuyot tatoy le do mesra adara balun. Ngora telgibel awanar sel IOC gimngara alsel malgora kya obrao da sel situation ngara alsel mo. Kadaman mo mesra situation o mesra capacity ra hospital tirgal sa lidel sa mong ratial tokoy lobang gamama lo mesra igal facility rigid ma toktang marnurs ol nga sergi del momalar tirgay gidil tira man mo critical al sugo mo moringi ingora di sadel makatakli sa gidil wase kama magimal direct take this very seriously direct kalbagi kar adamam sugo matamo smer even malakal sal mo kora hidot smer mo dakal si ilo mesra smer sige da direct challenge kamam mang testing adir ka malmol hindi gimla mo Russian del more tirgel symptomatic. Unfortunately hindi ka kadangay test kits. Sel adel el may gida mo sabi adel open testing in mar adra balu. Sige dia clone limitation makadamalo ngitra koloreng raat matingel waset tabagik lematak anganyar di mo ongit temlas mlamo soril mutel mel test o da dil mutel ngit adal wase practice preventive measures edo takang al amila yagi del test kits misel me yagi da mo sa edel el test o sisilta magi mamrur sel triage site brenga sulela governor Dr. Roberts sa el kongir kama may espera talgibir sel facility ngira tar hospital sel tabakara kli sa igid ya rogul adal kora ongir tamar kora o symptoms el mo positive amor sa igid ya toktang amor se assess ra adal wasenggang di espera Tylenol mormei adang girel mo malayakar direct kalkar mamaran may ngani akal dolap ngani agel maran med sa edel uspe hindi ko kora uspe sa igid mo mga sadar sa igid te elela adal positive algo ko si subira emergency room malubong ko si subira tara clinic se Dr. Makol al adi etsela klugo kung nyaw sal mamayo de kita opener sa igid o si siltay magi mo opener a hotline algo ti Doktang maluban nurse, amen ringi mansumang niya atarabulul, simbayal gede la symptoms ringi, asab elo makotong yung ringing gede medical provider lon nga sayo ringi na dingwa. Say magidirect mo announce sila kim establish ringi. Yabay kulingitra Dr. Makol maluguk kulbol ilsa daigel bebira measures sa giba mga tmok raklol hospital, including sa hotel awa klinik maabot ka. Sabi edel mo kutmok rel al kiret niya.
So lang ministerio malungil suelo. Kay gidel ligang at gidel chen sa bebira activities ra augurul ma kadamda urang asuliar bekla adal ikal merkol rurakal prepare il gidel tiang. Kita matela saya visiting hours sa hospital, blede limit ringil mo 1 hour. Di sila kapasingin, di ako, hindi ka daw tangal, mahal di ka daw. Ngari agel baby ra clinical gire dal mo stop. Agel do asendi kal emergency surgery. Agel kaya bo stop, hindi agel emergency bot kaya morngi. Agel clinic ra NCD. Agel bo do lukla el mora CH ngara bitara koror mairai kita mornya ay klinik giling mendia kalbel ber hospital ng kita langarnya adel pol expose al morgi kita bebi raigel changes elbo dame giringi bebi raigel klinik rarwa aigang amo to stop surgery ma medical ay amo to stop le gigil hotline o minister kama mal mo girela adal ngarngi agi bom rotate tra atama mal ngarngi mo da kal sebe dal continue baby regal clinic ay ga mol telgi mo ngara erul sandel mo budul edel sandel sel tokora haisya mandire gal mo trouble di mo emergency awa omlat elwing lagi mo stop mo dia ka dolat ngler di mo igel emergency tokora dentan diregal kamama diregal mal urang asulir community lagi uro laban trir sel funeral home kita diregal do uro laban trir kemudian masing 1 hour sel do ba adal mong 1 hour tengah segi de mo merek diregal mal lingi trigid la se kado mas kadabo el limit el dimo 4 5 al ada mora segi sel do ba target el mong wa madir kemitu sel tele la pharmacy mo sabe el refill la cruz dia kadang hospital do la gel cara y mo sigue abasio maybe en seguir bitara corol mo sabe ir refill la carir diregal seguir lo logornya ministerio hace mo sabe el mo do ratok tangar gitu tigel NCD el cansal tertil gire lagi del grupo. Mungkin saya di gal plan sergid, di dekat mokre elang, SL uk change rak lugu kolmong. Mung dia gal ligai ida sehingga kaya merkol uk tele ko do mes evaluator tial toy. Ay tigal mama sera ongeim lulul marma kasus. Jadi morme rangana midnight. Ay gal testing rirur ewaldar traba every day nanya one time te testra 300 almost well tirga uspe arrest el direct mong ngayar baby mlamos mer mga sige daw ul mo wala nga sa kabisit el mer hospitara uk mestira tama arauror metabreg i rotate regay del urel meribek sel emergency room obla mes at change ngi Nato tayo galingan sa abla nga outside. Mela ka me rik le ta skenger gi ra era da bo da sis sel mu til mor ya change el mar al sel el brar gi da me dia ka di ngara da expose ra ya rogul newing tigel mo newing a get tested emot mu I think sira 2 days ago ngaria adlul ba maaser gil mail mora mail engya test el positive yang maaser ngia so ra rol meng test eta continual test ngi en hospital yang lam el malu el dir ke negative el marma elam magata mal urang asular bek la adal mal ko lam lamu exercise ay gai gidel hand washing mai gai gidel masking mama ngal tangat el tigai del expert ngartiam elagi nasta telo volunteer so I get plan so go elanga I get el change rak lu kolmo so we'll evaluate each day mega changes komal sulang
Toktang. Perhaps at this time, Dr. Thane, Dr. B, able to introduce yourselves again. I know it's a bit repetitious, but and then perhaps talk about some of the work that we've been doing over the past couple of days.
Okay. Thank you, Minister Gafar. And want to recognize, thank you, President of the Senate, Speaker of the House, senators, legislators, governors, traditional leaders, ministers, and all of Palau. Sorry, last time I was here, same thing. I always pull the mic away. I apologize. Really want to thank you folks for the opportunity to be here. I know it's an anxious time, but really for all 4 of us here, it's an honor to be able to be here with the people of Palau during this historic time, right? And we're here with you. I want to introduce our team. This is Dr. Brostrom, who many of you know from his many years of work in the Pacific, as well as his previous visits to Palau to help with immunization, as well as much TB work here for the islands. I want to introduce Commander Kazu Okumura. He's our regional rec, our coordinator of really being able, he's the guy that is able to bring in a lot of those supplies and needs that the hospital and the overall response requires. And so he's been here working with the ministry to really look at gaps and help fill those gaps. And then on the end, we have Commander Nick Munoz. He also has expertise in identifying hospital and preparedness needs, but he also has extra expertise as an emergency room nurse and nurse practitioner, and he's using those skills and experiences from working in California and dealing with large COVID outbreaks in California and other places in the West Coast to help the Palau Hospital better maximize its ability to manage COVID-19 patients. I know that we're from outside, and certainly Palau has received support, but you know, really the most amazing thing has been Palau's ability to leverage your expertise and your own local assets to really create a response to the pandemic that is unique and has been a model across the world. I think much of that hinges on your ability to work together, work as a community, and really implement responses that are tailored for Palau. And this work has paid off. All the work that you've done since January of 2020, especially the vaccinations, even though this is a new threat, this Omicron, it has saved hundreds of Palauan lives, just the work that you've done. Of course, we know that there's still opportunity as we move forward to do a few more things, and that's why we're here, and we're working with the ministry to really do that extra amount to be able to further protect the community of Palau. As folks know, this Omicron it's a different virus, right? It's extremely contagious. The vaccines that protected you against all the other variants protected you from getting infected, Omicron can infect you if you're vaccinated. But the vaccines still help prevent you from having serious disease. And so that's why we're really encouraging people, If you're not vaccinated, get vaccinated. If you haven't been boosted, the boosting has really showed to help that it's excellent at helping make, if you get infected with Omicron, that you only have mild disease. And we don't want people to go to the hospital. We don't want people to have severe illness. We want to limit deaths in Palau, of course. So that boosting is really important. The other thing about this virus is it's so contagious is that it can move so fast. It has outraced all of the isolation programs in the US, all of the containment programs. If you look at those charts that show the infection rates, and we thought the Delta waves were high, Omicron is just straight up. So unfortunately, it may seem like, oh, they didn't do enough isolation or quarantine, or they didn't track the patients enough. But throughout the world, this virus is just so infectious is that it really makes, it just blows by all those systems. And so I think that's something to keep in mind as we go through. If it's very easy to get infected, it's easy to infect others. Even if you're vaccinated, you can get infected. So really be careful of yourself, be careful of that you may, even if you don't have symptoms, you can infect someone. And I think out of that is an importance to really have compassion for folks that may have been infected. It's such a speedy virus. It's really hard to stop the infections. So what can you do? What can people do? One is, get vaccinated, get the booster like I mentioned. 2, wear a mask like everyone is here. That really helps limit the transmission of it. And then 3, I think, listen for the updates from the Ministry of Health and Human Services. Updates will be coming up. And as I mentioned, this virus is really fast. And in order to be able to meet the challenges of this virus, the response is going to have to be agile and adapt. And it's going to change, maybe on a day-to-day basis. So that's where I think really listening to the Ministry of Health and expect that sometimes policies are going to change, maybe even within 24 hours, as we have to adapt to this virus. This makes Delta variant look super slow and easy, like a glacier. This virus moves extremely fast, and that's why need to keep in touch and be aware of what's going on with the Ministry of Health. And then finally, I think the last thing is, I really encourage, like I mentioned, this is an anxious time. I recognize that. We're here to help and support. And I really think that this is a time that all of Palau can continue to be a model across the globe of what can happen when people work together. This virus has divided communities all over the world and really utilize that division to spread. And for here, for Palau to continue that respect that you folks have showed to each other, the compassion and understanding as you move forward and do what everyone needs to do to fight this virus together, I think is going to be key over the next few weeks. Sorry, that was maybe you wanted some more specifics about other things that we're doing, but certainly over the next week while we're here, we will be working very closely with the Ministry of Health, helping to refine those systems to slow transmission and ensure appropriate response. Dr. B.
Thank you. And as Dr. Hancock mentioned, it is very humbling to sit here in front of the leadership in Palau. We are grateful for the opportunity to work side by side with your preparedness committees, with your physicians. We just came just now from a meeting with all of the doctors. And my impression is this, that there's been a change from when I met with them in March with the vaccination effort. And my impression is that we see the doctors who are very determined, ready, have already started with action, already beginning to prepare the hospital to handle cases when they come to the hospital safely. I think Palau is prepared. I think it's very obvious to all of us that, as Dr. Hancock mentioned, the work that's been going on has prepared Palau. I did want to also add that the partners in the region
are aware of what's happening here in Palau, and many are reaching out already. Support coming with tests from YAP, support coming with testing from American Samoa, equipment from CNMI through Guam already being sent here for your use. We mentioned already, I guess, the assistance coming from Taiwan, and then the Pacific Island Health Officers Association already in action to help Palau in any way necessary. So Dr. Headcock, of course, went over already. Thanks for your inspiring words, Dr. Hancock, and that's all I really need to say. We'll be ready for questions. But I guess you've done introductions, so we'll hand it back. Thank you.
Thank you, Dr. Thain and Dr. B. Diso kalaway sa kapsangay, agi of the trin mara talk show, direct kalguk te alar adrabalul, lomakotong mara call in live, also mga niya questions at tir. Magsubes ang kora, lagi rin kalukura uliyo tatigingin di akundas ang pera misalbura talk show, also mbay nga niya specific el gera adrabalul, sabi el lomakotong loker. Yakuk what the alm sa nga Senator Quartey ma Governor margukan nga sorry mo.
Sulang Ministerio Malungilitasin san mora arawila. Manuel wase no Quartey agora malso garngud. Sega com a máscara. Então, corbitar a farm di selberedela atoe Mr. President nakmer W belaw e kamam el adra held al bebira time di kamam el mo umdasul wasegle blala kal kimlu laureram kleblel sabam el magram kleblel sabam el advisor society a little bit better. Akti duli sa yidileng affecter yidilroguy. Ti for some reason ang affecter mamar adrahel 10 times more. Like you feel very responsible for it. Pero ahel ng alam, dahil sa aswam el oiti. Akti moblaktakl. Akil mutul modulya toil matatal di kulukurnil wase asain sa ngaringi. Ako lingit talwa sa po tapya atensyon ng mura science. Ele science mensagid a post el domes niya measure agir rogul policy decisions el dorul el gir el tagid el particular ract. Kada ngaltatele Omicron gidem na mokrok rabiled el vaccinated mangway release el bilen mo kapakla abaredel mergid. Hindi, Dr. Tigal expert na tongil was sila by the end of the year el mutul mkarokla imora variant. El tangal mutul mo hidort ya. Menggiredel mo korkik like el policy, menggiredel mo kauding el rokoy. Makul mutul duli tal tol mo ministerahel del wasi. Ngirem el continue adapt a preventive policy. Tial langaringi a reactive. This is not the way. Tiadim lakadongi laringi. Tiam lesebed el control laringi. البيس را ساينس امكي قوجيد المويه غلق من مدور السلا بلولاد من دابلتو مقتولي سيجيد النكسل فاريانت دبل سيريوس ان ديغا كاباسيتي جيد لورغدي مقتولي تيجي توي ركلاي ما بريزيدنت سينات ما سبيكر ما غفرنورز ما بريزيدنت ريبابليك ار ادلو غر اراهل بلا مال مقصاي Ingal virus, calculator sa el 394. There are other potentially tamra sila community lang ang rakmed 900 yung la expose. Or other ahel na tumogirel. Makmal understand ra minister, understand ra director mo understand ra kalor ko itigal maral limos kala. Dinggiredan mo protect our other ahel, the lomesil wasak de magrang stagger. Ayel scheduler tiri mendakal di tiro ko musmer. Mengdirek ngari ngara private sector trial stagger At tele lagi maurur, lakal malguk lamagim dahil support el mora community at large. Maktiduli sa gide presidente olingit elwase at ora sain sa dial criticism. At ora sain sa fact gide del moomes. Magoting akulgani sila tara ngatala sengara sumang way sa gide ngam kada test. At sumar adra ministry kuman lamo o dahil sa irmu ngam kada test. Kadam dahil waseng artyang. Makumda singgiril taratay, mga di mo asumil wasar at selbol sel, yung tiyagiri. Lendi kangod al tretel gimo mesra klinikal nga al sela blupelar il altay. Aong erung edulutul mo mesu sel palasira entri wagilo ko madra bugud. Mlamo di al make sense al sum omicron 3 days sa incubation period. Kita test other 78 hours 72 hours sa wala nga sa askoki. Di al make sense. Maktiduli sa igidle di el sela telaklub se president yung namlamu bra mo masker roguy mo bel mo close sa skulet maburden ra covid akmutul duli aburden ra covid al tangguk ora di treter din dal sa igida aburden ni au the sweeter other belau mar adal dal sal sa bil mra gurur elang tirgelo re kada igir raktir ngari atel din mosmer Dia kata mal masangara ayga. Nara school na mo dia sin masku. Ayge ya burden tel covid ndari. Makarilo asemla may kata ngal tanga tel kata vaccinated ang bot awngi bot eokli lang ataw tadi memrael. Actual ngi tel wase la momda societe ya endri. The next variant as el mutel mohidor dia. Ayge gungui bel babere la time makwat tel tel urang asuliw edige kita pokton kom sulang.
Milo to song presidente para claim tigan luwag ma other rogui bring time dal bang ringi hindi gida ko tanga tablu hindi redo di mrenga sular bap to josra rogui ng dai ngari arod idarak tanga ringi ni gida klorngo mari gede ko salbak those particular time, we have to thank you, Dane, Dr. B, Asper team. Thank you for taking the time to be with us at this time. Seems that every time we have trouble, you show up. So maybe next time you show up when times are better, we go fishing instead of sitting here and talking about something bad. Anyway, thank you. For being here. Marenga Suliarada, Ministry of Health, Ministry of Human and Health Services. You know, President, it's been 2 years. If we look at it, in 2 years, other hospital, we were in a preventive mode, prevention for the past 2 years. And it kept us safe. Indeed, we had to progress, and we are today. So we went from prevention, now we're in a damage control mode. What do we need to do? We need to do everything we did during the preventive mode, but do it even more. You know, get roguilo si sakrigi that kept us safe from day one. We need to do that even more now. We're 95% vaccinated. We still have 5%. We need to vaccinate everybody. Vaccinate. Boost everybody. Seguida science already Senator Corte that we know works. Seguida sa akrigid. Hindi kagiyad madak. Yada kayong sew encourage everybody to vaccinate. And mask. Kung nabiyatar mo na mask, di mo nakangarang. But now, we have to mask. Yung minarong lawais, yung musel kamadira video, it's the first time in Messiah other video mask. You know, people are getting the message. Masugong magiging ngara,
a leadership position na maruningin, another ablu o giuled. So we need to, igigid preventive measures needs to be even more enforced. Vaccinate, we must. Yatiagid ontik, sige da matangay ngasong sa resources ngasong sa rogoy gigi da director mogol no we have to prioritize, we have to limit certain things. Hindi akmal yoling it, we try to maximize services. Hindi besra I get more pressing common problems every day. Gida mga rather than every week. Most people are dying from NCD. See a side effect. It's a collateral damage from the attention we're paying to COVID. Kadangat-ngat hindi ka other mother COVID. Kadabro relet. Dila ka daw best was a problem of NCD is with us every day. One another missed appointment ringing. What ya kakarul? About say that's a casualty from COVID. You may not die from COVID directly, but it's COVID related. I get everyday clinics close to them. Example, in Al-Karayul daw, Iroidra Rokoy. Several songs of resources sabi bilat time bet di men di anur siyang umray lang. Ngayon radim lang anur siyang in 1 week. Radio the last 2 weekends hindi anur. Lang mga songs of resources. Hindi those kind of things akong das hindi rin mo ok man mo ada dul mo ngil wasi the prioritize ang rang. Ityagi da yelo ko Dr. Quarte we have to akong das Minister Gafar testing burden ng our hospital. But it doesn't have to be. So, I think we need to plan and do more testing sites. Of course, the clinics on myself. Ninsa edun rulia testing site pelingin labru mungir Paulao north south and prevent people from coming to the hospital. The rural testing sites all over the place. That's what's happening at Taiwan, other places, and that's how they manage. We need to do more testing away from the hospital. We spread the burden and hindi tilong kadangat-tangat kadangat sela amaringan labre lang hindi kasal ba tumigilan mo klor mo de ba imot to goy idolo president kanya seu mga gina ang leadership position kadang mga lakra adablu mo klor ndir like Dr. Quarte said, we will get through this. Kumam saun.
Ando sulang Governor Dr. Roberts. Wala to para te alalo ogerager idi klugtel ngale rabekla adlo se fodo lokor tirigel kalorus o amrusa malmol Brusa malmol malmul al-sil misel vekel kot lurior ma onge te lurior ma onge im lurior ngaringi sel Pfizer mora mar clean morbab first dose ma second dose esel ku kongeru lurior ma durstay yang maternal booster ar adults ngania orus malsugo mong ngania adal modon tril giril mamrus malubong ngania ngalgiril sabiin mamrus edog takangal kay ngisel lori mertila sa pomorus Iman lungil luldas we governor sa igid mo testing ra pagaro sa basyo maldi dongi lang igat test kits kamama mga mokra plan el momruti la igid o sa era adal test adi swadal lolingit ringin sa igid dilya senator Quartel wasing at adi mreda hindi gitolingit adal wase poto karigik Tor kita mlamrus matanda ko dol swal lo se infected. Iba yung mo rabli del ngarinya uod dalat malubong maligid targid del ngarinya rektel. Isegi dinga mo ula adal mer hospital. Te elela adal me giren men yuing. Kadamal ngatangat lemral ko rat telgibel kabakak letyang. Rakuk tokoy ra sa redra patingid nding jakal kabakak tokoy. Jakal biyot tokoy. Madakal biyot talrak. Kada malmutul ngita bekada se di boda kargikla. Sel do mesra plan ra NEC yung wal sa edad di malmol marukuin at time. Di direct tokar adal madakta. Malsukum ko katim mora ko ra klol londi ela ko pong. Sukum makatim lo mais la kamadakta ela kamo mais. Tokunit sukum ko koras me el alla ka testing. Katokora bagikle madakta hindi osisita ma do mesra bebira adra belum kora wala kang ram. Makada malolingit tra bekla adal wase boda ta ko kuy. Ito takangal kaukledem me takay ngesew. Giret tel tokoy. Umdasil ana mo sa edel kuk penate alra adal sorry ra lo geraget. Senator.
Sula Ministere Nalungil Swelben Marbeklat. Good afternoon to Dr. Hancock and Dr. Verstrom and the rest of the Island team. Thank you for coming to Palau and assist our public health people to help with this situation. Minister, question nga ka, ngora tokol question ding wal ko di connected. Al dilungil di ko adik muro ko yung idergaw malbit article al adra CDC bal civil guard responding. Ako te in southern moment ngek na tial COVID-19 may kay kita lakarusel variant ringi ay gang sabel mara sabel mo multiple times la ada contractor ringi al sugo mong waise every time la contractor tayo kita COVID-19 ngania kora impact ringi morsel effectiveness tial antibodies ngarabatingem malubeng o ito tour malubeng katalgibel help smisiil rula immune system rakal wabol sabel smisiil lol da alakat yan ang erul gariga akmlasing elal domesringil welcome namonia community spread given the fact that tagid al omicron amal baguyuyul ikado sa edel klaseng wal latalgibel lengalakra a controller gidal sabed el bread el stobering mang kidetelo mesel sel lo urul dimral moklo given the fact that nasing klangal sa sel capacity ra Ministry of Health en sa edel klasetya will be with us for some time. Say the fact that nasing mo banggedel makatektal time, it's gonna definitely change a dynamic society rigid, especially tele other belaw ra ikal sugang rigid el mokpaldib el maasang beto kay gigid ko ra part ra event el mokpaldib beklad mga daw marak na sa gigid mo uling contribute to more a close spread tagid el vaccine. I guess a point to trial raising up na saying, given that situation in amlamo tamil kukira del lo mesra tletale kada kadolis akra adrablul mo o not only overcome or say del daktir malimang anxiety til gil terrakt kadirek lolis akra til mo adapt el mortiagi del PSL kadudula sem new normal for the Palawan people. Sige da kumdas ang cloud tutulel as leadership gila de lo mesrik na saying al sugum tiang ado mesringi from the perspective ra held officials ikado mesringi mo makatektal tamil ngara al sel belaw mo makatektal direkal mo ngani ate alla yegi del guk PS variant el dub en mo o mo ba el challenge el boda al bangala en agire del dire kal daqati di lolis akra adra igay del tokora au mask ma mo mala vaccine dire kal el lo aisar adak na set yang ama partra anormal mo ba normal partra life forgid mong ama agire del ku kachasta tele dan maragel bekal tokol dorura bega igal imamade kadamrura bekal silsa tokora ama sang ma atokora mara school atokora mara urior ay gigide ministerio kora es el cuestión lo gadim de soal loger es el lubong la ngania del lo texel milk na se kamogel na sing melal sum maaring itial situation laspet tial raktra blur belaw ya ngania ko kora plan gid el platakat maklil girela al sugum moria adal mosmer tial raktra enguk magara tretele labo da tehender gigid el adal mosmer kada mo isolate ringira hospital ngania ko kora tugubets el tretele kada treat ringel adal el malmosmer el direk el sabel labora ko dal atet la kamal di lagi ako dasang adirek el baby plan ng awda swira adal sorry mo mringet na sing kabalment rigi ng ngup ngarawal da swel giri laway gigidal situation sila minister
Manusulang senator. Urak mo te Alma Street tirgal sembong rarak te giri lagi kotel tablol karim edik poreng gelong edey. Akti blakatak lo ay sa tiam la pre travel. Mangmoringi ar adal mon yuing. Il amoringi ko tal. Esel plan al domes ringi dultuy ringi ap le plan ra egel variant traway. El mlet talgibel lopting la ending talgibel soro. Tia mali misra buguyu. Magumdas direct kal ul makadokora amalil ta kakarosel strategies regal kakarosel faces el plana o mesel lo sengra sa edukut mokrel at time emeral klal kot mapli mesel tokoera school emle close adia kal ngara phase 2 ngara phase 3 hindi kitam lo mesalo sa dakat makli sayang la direct kal sebel ngosugi del marobra prideltial rak mal maring leng saygid wal dil blel al sala edel Sunday emoringin gagid el BS el variant temla a pre-drabl other rogir emla soy se bebelaw ngira del bla takir saygid egal plan adrul ndi bebira time ngira del buk moltaw takagaro sa teletelel el mo atter situation bangar alsel mang kumdas sa saygid el pornya kodal ngira del adi omesra tetelela akamaldil waseng mang wangrang may gigid el dongot mokre at time ay gigid ya kot el bodo at time so apli kada marus o mask malbal moroy dirgi dirarat omset el lakamumais moroy dirgara adal smen ngari akar sa edlom kara adal niya amosmere toktang amesal waseng la uspe ra karal lon nga seorngi hindi namodyak sa edlom das sulase nga kamodyak ngutyang. It's that contagious. Hindi sa paedel taligibel malasman soror sa igidel spread. Maral way saya new normal at igidel. El altirgal tewal adra CDC ma aspera o banggedel ngarter ilang o sisil tayo mangguk nga niya team ra Army Corps of Engineers matara toktang giguk kum Moriolo Banterilo mesra hospital gidel waseng makarang abodorura pa ngaraigel girel del gargik girel ulang problem hospital elang mang seguida direct kal challenge sa kamar el alrak makarado takawar tiyagid el rak del covid o sisil time kadamal mol maigel kuk maklo tu talel luria rabek el silsil girel del gutmok lala kamo ulay gagid lo ulokoy tirgal terul toktang argid NCD ma gel gakaros el tokol niya dimla ulse ergid ang ramo. Aktingon mo sa igid ya kuningitra Terul Toktambrol answer. So Dr. Thain and Dr. B, the senator is asking, with this variant, what is the reinfection possibility of being reinfected, and maybe talk about immunity, something like that, regarding this COVID Omicron variant. Sorry.
And sorry, just to clarify, the question is chance of being reinfected after having Omicron, and then impact to the community, or just a...
Well, basically, my question was if a person gets reinfected, does it affect the effectiveness of the vaccine or the antibody that's in the person's ability to fight the virus?
Okay, yeah, great question. So if you have been vaccinated, your body has some ability to fight this virus. The antibodies, that's one arm of your immune system, they can slow down this virus. If you've been boosted, then your antibodies are even better at preventing and slowing down this virus. After you're vaccinated and you're infected, that vaccine is going to help reduce the chance that you have severe disease, that virus is able to really make you sick and make you go to the hospital. So it's so important to get boosted. If you make it through that, so you've had the vaccine and the infection, you're going to have good immunity for the next few months. Now, this is a new variant. We're not sure how long that immunity will last, but if you recover from it, you're going to have even stronger immunity. But that vaccine, it's not that the infection of the virus is going to reduce the effectiveness of the vaccine. It's actually that vaccine is going to reduce the ability of that virus to really cause a bad illness in you. And so that's why we've been encouraging folks, that booster that we're finding, that the booster, especially with Moderna or Pfizer booster, if you get that extra booster, it really helps bring up your body's ability to fight Omicron and really help reduce that chance of severe illness. So I want to encourage the community to do that. You want to add something?
Yeah, just one last category. Thank you, Dr. Hancock. And that was for people that got the Janssen vaccine. Last time when we were here with the team, we went up to Kaingal and we gave the Janssen, better for the outer islands because one dose, right? Those people really need to be boosted. Because it's Omicron, there isn't enough protection from just one dose of Janssen, and they need to get the booster. And the public health has the boosters, and tomorrow will be their first booster, and I believe the hours are 9 to 3? 3 to 6 in the evening for boosters. Thank you. Sorry for that. So it's from 3 to 6 for boosters. On Thursday, we'll also be open for boosters, open pods. And then depending on how busy that is, additional clinics will be added, possibly even Friday or Saturday. So they're working hard to make sure the community has access to these boosters, which are really important to protect yourself from Omicron.
The other part of the question, Dr. Hancock, was if you get Omicron, can you get reinfected by Omicron?
Yeah, that's a good question, and sorry I missed that. We don't know yet, right? So we've seen with the original variant, it was very hard to get reinfected. But as this virus mutates, it's likely that if you get Omicron, you're going to have good immunity to Omicron for a long time. But we don't know what's down the road, right? And so that's why I think it's that being prepared. We know that the vaccines help, and if you get through Omicron, you're going to more than likely be immune to another Omicron infection for a long time. But we don't know, what next wave might be coming.
Halle di ko yuta igel tingel ge floral sum dingil mar adal guk pati beraran dira torang abarda bol sil remains. Mulwase angel sel obam ser ang kaya del besel virus kaya del Omicron en ay yelo rusel blamngay ay yaro lima yelungil soldara patengem active MCC menggel kal virus ade al salmal mohido ya ayel wayal talmelel mera patengela diurir obam ser ang kaya del Omicron esel wayal immunity yelungil soldal mutel mal do el aklisiel mangusugara next infection or sen question ase Omicron sa mutel mosmeringi mandir ka PS mandir ka balo dingel hindi kal enough omsubel waseng ngariar adal mutel mosmeringi letrigel mosmeringi raw lela dir ka ngaya dir ka msisi immunity tidel igelungil soldal lokadan kal Omicron adir ka msisi mang telalbu ra armada de gida mom dingel waseng seda mosmeringi malbenda.
Dire que president di edni mortiang sel mlekot sa kontrol na COVID sel mlekot virus mlepto ada madri gel nomgoni na ada sel terminal virus no tengal ma sela olmedet sa lungs sel vaccine lururi amlor sel protein spike sel niya mo prekta sa lungs to mani olmedet na ada mo da sel utri hermos mga masil molmag. Ilakakaraw sa segid original virus sa segid mo tmuran sila lungs lower respiratory. Ilatyagid Omicron ay guk symptoms niya dun di nga upper respiratory. Di nga umorgolet ang meron pa po. At sa isngit umorgolet tiyal at sila nga rin. So segid lang unmar adra Ministry of Health and Human Services sa wasi di ako mo lam, di ako mo lubra, public. Di ako share all baul. Mamarani presidenta wasing abay ginoti o tabiyato ko wasay katapan o manam 2 weeks. Ito mesari. Hindi cloud to tayo lang di sige malupa man. So el mare to spread the character. Yung artial sa ngare ma padma. Sige daklakaro sa gitu.
So lang Governor. Dr. Thain, I think one of the questions was also about the duration. Now that it's here and it's spreading, what is the outlook on when this surge might be over?
Yeah, that's an excellent question and a really important one for Omicron. The fact that it moves so quickly through the community, and we're seeing that right now, means that you get these really quick spikes, and generally it looks like it also has a quick decline. And so instead of a long drawn-out wave, it looks like you have a really tall but short wave. In other places in the world, and modeling right now is saying that it generally takes, they estimate 30 days from the first infection to the high point or peak before it starts turning down. Of course, these models are based on larger countries. You know, it may play out differently in Palau. Also, Palau has a vaccination rate, unlike many of the other places that have gone through the Omicron waves or surges. But this will end. We will get to an end of this surge, you know, regardless what happens. You know, it's not that it won't go away, that it'll probably go away completely, but the surge will end.
Wasetia al tayid el bes el virus, wasel tel tiyed el wase etaw. Waya dil lame merwaya ngalak. Ul mangway segid ya sel klamatela sel omutarak tel morsel aniya yel waya obomongir tal momring la omargolem mal ube mokluk mal ben kora mom itu tabadingem adi ede club say yel bebira virus amlege kamangal belgula sa ulmang boyu ngil maredrom el meselo lom el morsel el bol mersel generation emla mode arabulwa adome sa yel bebira bulu waya al deal start morbab ra al sel order club say sel gotel ngarba hindi al sel mulwa sa belaw mo ara lang ako tengire population ergit betor gid am nang mayobo. Mong behavior. Atelit. Tiya taragir. hale Minister tayo da kariga betul kama madriga kim nga booster sabi edal mo mala booster hindi ka mo dek kasi kamlang hotel Omicron hindi ka sa imloger tira kasing hindi ako dek masik langu ding neso kamera al mo na 3 o'clock al malaringim girin mo test na al makot kasi ngaringir nga era popular teloru sadak makarang
Sulang ragere, Senator. The question is, since we cannot test, but if someone wants to get a booster, and maybe they're symptomatic and they don't know if they have COVID or not, can they still go in and get the booster?
So I think that's a really good question. If you think about, the first thing is if you're infected and you don't know it and you get the vaccine, that's okay. That's all right, it's not a problem. But if you have symptoms, especially now that we know that this Omicron is moving through the community and you want to go get vaccinated, actually, that's not the time to go to a big crowded area if you have symptoms. And so I think that's a really important thing. This is a time when if you have cough, runny nose, those sort of things, it could be Omicron, and it's important not to go to crowded areas. So we will be doing, I think, screening at the pods now to ensure that the pod is safe. People will be wearing masks and that sort of thing. But the good news is if you have Omicron and you don't know it, or and you get the vaccine, it's okay. That's all right. It's not going to do anything bad.
And last follow-up, Minister, so kaloger tilak kasi nga recommendation or given your limitations sa mga resources sa hospital alta, would they recommend the limit of flight? Mumos sa umil iway we di ako mpwito lower. Kasi kami tel kasi hindi ka limi Dr. Magol. Mga katoger kasi siyang recommendation sa baril di ka offering ya uptang political question al dakal gina dalogeri.
The question is, what's your recommendation regarding flights? Is that something you think is feasible at this point to stop flights, or given that it's already here?
Yeah, so so first off, flights and the borders are really, that's a Palau decision. There's no CDC recommendations on stopping the flights or that sort of thing. So it's really a Palau recommendation. I think the goal of stopping the flights or screening the flights is really about trying to reduce the chance of introduction. But we have it now in the community. We don't want a whole bunch of people coming in that are infected, but the ultimate goal of preventing an infection actually has worked, right? There's no doubt that in March of 2020, I didn't think it would take Palau all the way till 2022 or whatever till you had community transmission. You've done a great job with your flights, but now that it's here and looking at the flight, some of the testing, I helped with the testing last night of the inbound flight, the day one testing, and in fact, I was one of the people that really encouraged for it to be put in place when you guys had your Delta cases. But in all that testing that the team did, they didn't identify one case on the day one testing. And that really shows that testing before people get on the plane is helpful, right? It's helping get people who are infected not to come in. And then I think recently some of those testing of those batches of people coming in have been negative as well. The unfortunate thing is now we're seeing, when you compare those rates to the rates of the positives and contacts from the Palau community, it's quite high. So again, it's really about resources, as you mentioned, and I think weighing the local decision of what to do with those flights. maybe you want to?
So again, as Dr. Hancock mentioned, very local decision, and there's strong opinions to close or to stay open. Just from an epidemiology perspective, from a medical epidemiology perspective, at this point, I think what is going to happen here in Palau is set, and so I don't believe that it will change the upgoing case numbers and the trends that we see in front of us now. I don't believe that changing the flights would change that curve. That doesn't make the decision. It's still a decision, but epidemiologically, I think it won't make much difference.
Me kuyu dagel tingela Dr. Hancock ako tungwa se al sugum ka mamla vaccine lang ya dia symptoms sergaw eng maldiungil. Yung ma-observa COVID la ka kora olang alel en semel mongwa orus. Dil sumang ngani ako kor ogi kluk malubeng maring labdenge malubeng maring omar kolem maring laptulum. Amaring dalungil oborsel tabtor ad makmola yulil mortir. Hindi ok moral tayo makmo et maskaw selorus hindi ka ngaral tamali. Saya ako tel answer. Ung erul gukmle question na se laway segi del mal namo wayal mal namo oklo brauda already other ministra held en kalelungil the stop a flight ya tingil terong asendal ngal alam recommend lo sa stop a flight maluben dia. Hindi Dr. B akmul wase dil sugum tial rakta already ngal al selablu la o pre del ngara community ya flight ade abol change say instead imrael mo morba instead lo mesringi el wasesel ngel 1 awan el mo 7 ya 7 na mo 49 at the time sera 49 na 7 en seguida tetelela lom leader al selbelo so el sela 4-5 generation they gonna now reach 16,000.
Question, Minister. Girela a planning ra operation ra public services en ada bolse ertial go al Omicron. Telal days en smer ra clearing is mil return al mera workplace. Man sa mamal bol ngaringia infection ra kung ngakal involve ra post office el sabegal plan ra rolela operation man sa LD open operation. Ako ti bokngul direk lo dersil marawlaw lang. Aki involve ra mijenti. Ako mda sa mijenti lang planel mo online. Capability ra internet capability ra mijenti la adi kal sabel. Al tirge rogul sensible online rogul lo lisak la. Seguida tara challenge el gumesringi marolela planning. Makti odar selego kulit mal skumaria kamento.
Mansulang postmaster. Selgot talgari melgirela adal mo positive girel maalungul el dakat sa elorior madakat sa elomais. El alta mengwal dir kal tru el club say. Segi dia dir ko dos peringi. Tokuni el al lolngasong sa test en girel tru say. Hindi ako tomes ra gel guidelines ra tirgal adra CDC ng wase sa LDA merklabasay el sukum mga test mga namo negative and sa BML wam pomere kara isolation magi dir ko mesringi el mo sing wangranga mo segi der kalsela isolation hindi el alta ng wal tru el klabasay ra adal smear close contact at suko mong close contact mora other positive mong quarantine 5 days at suko mong test negative and released.
Minister.
Yaw po Senator Tabalwale wagel dilong atay ng self testing ra kasus ra airport le 112 la adamle dimle negative. Sel skogil mlaringi tirgangan may ra ongewal urior direct kalmle 99 la day 4 lendim la test airport emle negative rogul Senator Tabulon.
Saule ministere reklai di podo yang klema dar sasus agotak kongel wase akmal oisi somrenga salmora adro hospital agi mlar ser eli sel test te maran mle kamang tem lomre kara elon mukloge man mle mungil latre teli adra urol momre tatak kamen der kami yobang kami usei aguren sa sel tan so medi de oren sel akadong do ni mekteli tiang lom te adra blu angira makadalian madiram tar busul wase el al sande ke mal oren sa tokol tokol bel tigring ya kari wase tian lomre el sande melang lar adra blu bel tigring mlarkir Oy, adrablo orange, el tirak. Te kuni trali dresim direka bot orange. El bis amda adrablo. Lengaria langlir. Atar el sulad lang clear. Au unum tel mangalaran dir. El lingi trali dresim wasim. Mesamam. Makti odresi tel mera arong ler dresim wasai. Sia langlir adrbelaw. Terang strir. Etir orange sergit. Sulang.
Sulang Senator. Ini angot alger. Mrs. Reply. Ada telepon ngayon. Taligid.
Malungili tasils. Minister ang nga tokol question ang dikti malbetokaran makti mo aska mali tablong. Ako te ngaring isel tokol blon mention ngi Governor Dr. Amais el mesada gaki dele testing el moringi el option el momra testing ra karo observation. Ngaring ako ra ke rabulula se selangaralan el momla test el atirgel blal identified til positive en walsal ko ramal ka mga lalay na mangkora akira sende kalsep LD kal moringa ko ra mobile testing sibir ada linga ramla le ko kom tester ada lubeng kaya kita ko di tara question am lamay ya atara question na wase mla tamla answeringi makwa din mutel mo reiterate mutel ko di mo askering mo bla takal mo ada soril mo ulmo madengay ngaringi ako nga directive lang amla chance el directrical travelers el maralmi little bit el mo waseng utamo test airport lang hindi a question na ay kasi amla sering hindi tilmo talo keringil hindi kalsal mo bla takal mo rablu asay mang tirga nga al test bel sis ba ngaringi abol effect ngira tial remur terak trablur belar el time ngayar other askola sen dia kami the shutdown the bora lockdown rablu el maybe el flatten out the tial curve ngaringi bol effect ngir say tial luldas la se kada create lockdown ngaringi marali asum kada mruringi agi madengel la se komla kada la close school try to control that trial mruringi medio di seguido ko para kaya ngaraplo asay okmom baluro ko baluro kira lockdown ngari aklol volkat makli seguido tara koraklol kaya namirablo last talgari ka di mor kami asay ngari yawan ra clinic argi del la experience ra tegi del sera ngari smer el mlong el positive manglo affected tigel adalo urior mangwal blal limit ta hours tir ma question asay aklol hospital gi deng kom la test tirgal toktang minors to what degree ang okmongara ang ngira sem beto ka cases lumais ngarabol affect ngira operation ra kami wal sukum tamoringa 10 or more service providers mo posme tel rakta
Mensulang lay sel akngur sel tokara testing first sel na kotal galim wai sel adi dongiring el anga test kits mesel lamay kita mo sa edon ngungel mobile lab el ngul mok la testing ra ka karusel basyo lak alwe de sera al sela October يقدر إيمون رأساهي لقلويد نديرك كلمة درايف ثرو بس إذا مرورة درايف ثرو مرأة دي أو مقال المية دقل تبدر مليرير يقدر مقرأ تيست ديرك كلمة نيات إلى سيل تايم المليوك لقا غروس البلون مرورة تيستينج نشغلوا أيسا سيسيجي دي التيستينج أديرك لو أول من دقل تيسكيتس للألتايم ملتلا التيسكيتس دولاب إندي تدير له سندي مرة التايمينج إكسباير مقول ما جيت تلوب دل ممرورة تيستينج رقمينيتي من ديرك كلنغاريا أجر له سنغرام من التايم قدام تدير تملا تيسكيتس سيجي دي لقل ويدم لول ملتلا التيسكيتس دولاب ملقيرة المرة دلول كيم دل إكسباير يقال تيسكيتس ديرك كلنغاريا الشيلف لايف رنيم unfortunately يقال دولاب الآن مغسايل كوك سبقل last المونكس من ديريك التطوغ اللي البابي التايم تقوك اكستندا يجي الاكسبيريشن التسكيتس من ديريك المرين يجي اومس سلون يرول جيرا لا اسكوغي ويجت تيلون يقال نمر قال تبلو السكوغي عندي ملقا امدان عندي سكوغي را اندرا ديسمبر ملموت الان افريج 1 ملوب تتيرون السلبتوغ تتيدل ادا اكمير دي اند اب المو بوزيتيف out of the whole flight mong asa edel mugtul ogertil mugtul makataklia angir til girel tilang lo sing ngarang ahmal impact ringi hindi domdas lo se alblal tura blu ing la direkkel mo girel gargi kra adel medrigi altang la direkkel smeer mong el time la mangod a situation na modakal sa edel di o mesra adel lo bracelet tel dir kagila raskogi mong roy dirgi ditti namo gida dal digar gikkel bekla sa gid ya reality da ka tester el time and dal sa edel mo madangi mong gida dal dibl qatakla jo si a risk ra adel mekmerd ma adel meder gaw especially el adel gora symptomatic longir tamaluhum oh sel adra rior why say oh
Dr. Tain, the question was to the minister, but I want to add another part of it. In case the capacity of, let's say, doctors and nurses gets to the point where everybody should be on quarantine, can the sick take care of the sick? If they're asymptomatic, not sick, those who are tested positive medical personnel, can they take care of other people who tested positive but are symptomatic?
Yeah, thanks, Dr. Corte. And we've seen that over and over elsewhere, that people who have been recently infected, recovered, they have the best protection over those next few weeks, months to be able to take care of patients. The other thing is, in places like the U.S. where they are low on hospital staff, these infections, unfortunately, doctors can get infected, nurses can get infected, like anyone else. But if they are feeling well and they're positive and they need them to work, CDC in the U.S. has said, all right, go ahead, wear a mask, make sure you don't infect your patients, but go ahead and work. Now, we don't want that to, that's not the first choice, but in need, that is allowed by CDC.
La question è presentata agli a Bulgaria lo se labora targela il disirar adra hel tugunir adra toktang marnurs ma adra lab يجد أولاً لو أسمى ministry health يجد هذا لو spare ترجع يجد al time من مرو like routine testing. I hope it the technical people because I hope the other other ترجع highly trained الآن بدو spare تيرا تغير عسير المرو لا screening al time. I hope that's not شهذا al happen. The question that يجد أسوق مرال توي مقدمور sel kotel kurba buera rogul to nurse malubet to toktang agiri ngara quarantine let either at close contact or at positive. And sabi el positive de symptoms serga take care adel el smera covid. Nam sel serangod rak. sertial COVID. Let's say ang ariar adal mo tibel hidaraktim matangara isolation ra hospital ang si tigay del healthcare personnel dili ka positive attested tire mo take care amle hensinios o se oy because ayel baby rablu mal mo imisel nga baba gay sinima mo overwhelm may al hospital ti tokongel wasa nurse maluben tokta maluben adra guru as el tested positive hindi na ka symptoms ringi ang lo ay role protective giringi mendal lo liungi mar baby rarat take care tirgal COVID patient ending dire ka sa edal tara time as mga emergency situation and most of it dire ka take care of the regular patient sulang
Diligat tara kamlan niya kalip.
Malungiswel be minister. Ako te mal merenga sulem kau maradam. Kadang-kadang lo si mal overwhelmed with the number of cases. Dire kalau toirar adel tigel ne close contact. Igi tial orang sa again numbers lo si ngaringa 394 quarantine. Madire kal possibly more numbers are in community already tamla exposed. So ang blakatak alwasetia, the number will continue to climb. Mandiaka question say, dire kal matingel waseng pamilya to wasegil isolation sites real time am la momuy. So ngaringi tigel gu koralay ta cases itin, kom recommend wasi kom marablimeu, albol worsen kom lumutul mer hospital. Di tiagi dagrig. Sel belsis var other airport. Kom test til of tiagi del antigen test. And then the more May, yang ngaringi segi del 5 days el ROM, kami test tira 4 days, lunga PCR test will make sure, yang adam ran negative before al bol sebel mora public. Akti ogel waseng sel tester airport conductor ngi. Natal tester other airport and show negative. 4 days later, a PCR am tigil mo positive, and then ang ngaringa follow up.
Sulang ragere delegate. Allah kalwid hindi ka test dagat maklir airport del negative and up mo positive. Allah kalwid mo isay.
Malungil minister, close to trail logi tel meeting ita the Saudi mar adrablul bol understanding yang ngaringa gerao rengal wasing. Maybe self test ng airport is not more reliable. By so the PCR test alorungin dig the matingel wasing. A PCR test omorungin require mo true alap el mora result mo. So moblak tak mar adrablul wasetial antigen test alorungin airport just as effective way a PCR test. Di tidak kalau orang se minister kalau meset yang tigingel tial doktor akni luasing Omicron atau mesinging numbers claims of mal meredel tabtigra ada kumatuk na musme. Kita matingel wase president tawluay sigidra ulel wase school awla the closing for 1 week el moktegar se ada kalsoada further el spread el logio arangalka el mora public el direct. Mensuada el direct el arangal el bolo dingel wasetial el nombre gara school el 1 week dia kal giriu lombi vais rablu. Le gombuk molo mais e mosmer e clo tutrel mara gel erial maringa blimiu lo tuti sel me moktegra atial togora me close school for week. Di tiagida di kora di ulas school maska minister Kita tialo mesra governors sa igal states tiro together at 12. Do mesa igal isolation room ang mla mo full mga ngar adal moldur tiro sa selogom wasing girul mutul mormay alworsen ko may. Di do mesa tial wasing hindi al motel tal time ang la amora babal daw. Kad bayo ngitra tigay gidel gu kongra la igal state governors Sa bolsa PL, morning meeting, lobong game. In case yung maral ma-necessary lang di kaya ay isolation room la hospital sa provide. Bolsa PL, guk designate ay center ay state. Tigil other mer or test positive or elbong elbor ay gigil designated area. Ya bolsa PL, tigil ranches ay state. El help el monitor ad malakalomais. Elbor abliri ang aring akrol te al guk mulo yuli ar ad abliri. So say the dasul di kwa di so small di minister o ring alwasing. If yung kadamaral maasay gid situation, e bolsa pwede utilize ay gid el bebira ay gal bayar ay gal states, e bolsa pwede bolbe otra adra hospital el monitor tigal. Until clarity et tiga malmol mga ay kami mo clarity wasing mo sabil ma public india. Just like what you are doing now. It's unfortunate wasing ay gal isolation sa rooms. Amla mo kumla max out. So say di ay wala di option ng good seal wasing. At sumong more sige the time unnecessary. Itong udur governor sa those pa ay gal wabay ay gal state el most of it mar control a movement ad malakalom bibais. Ma'am sulang minister.
Ma'am sulang delegate malungil das. Of course kita to matmoklaw rio ko to give sel maral teletelel. Tilang direct kaltoko mara NEC malsum ko na maarsa gid el level agire la NEC activate. Of course governor sa direct apart ra NEC if I'm not mistaken. Sa el guk through ra national level le maro da kay sel gut maklit tilan malungil das sulang. Delegate ra ngayaw mlani nga question.
Virtually since reclaim namlu susma digulingit baisa kan direct tra kayigil mora tigal tok tang la CDC minister. There's a question going around. May I address my question to Dr. Hancock or Dr. Person? There's concern going around that people are asking as to whether Omicron is worse than Delta but Dr. Roberts has alluded to some of the characteristics of Omicron. But to our understanding, the SARS interagency group under the US HSS have made a classification of the variants. Understand there are four classifications of the variants. There's a variant of interest, variant of concern. So my question with regards to this Omicron is, where would Omicron fit under those four classifications? Can you explain to us as to what are the characteristics of that particular classification?
Mugsube sa delegate tong kamlo da kalsal clear.
Yes.
Okay,
I understand that there are four main classification of the virus. It mutates. And according to the interagency group of the United States of America, under the HSS, these variants are classified to one of the four. And some of the examples of the classifications are there's a variant of interest, variant of concern, and there's other two more. So can you please tell us as to where would Omicron fit under those four, and what are the characteristics of that particular designation?
Yeah, thank you. That's an excellent question. Again, looking at how there's actually a wide range of variants of SARS-CoV-2, the virus that causes COVID. But you're right. Out of all those different variants, there are some that have been elevated as a variant of interest that the world wants to watch and make sure it doesn't cause a lot of trouble. And then there's the variants of concern, which is a higher level. And then what is the top level? It's variants of high concern. And so those are the really high ones are the ones that absolutely escape all vaccines and can cause devastation. But Omicron is a variant of concern. When it first came out, it's a variant of interest. The reason why it's still just a variant of concern is that although it can escape much of the vaccine's effectiveness at preventing infection, the vaccines have shown to really help reduce severity. That helps it. And then the other thing, and you may have read this, and we've talked about this a lot, that Omicron, compared to the other variants, while it's much more contagious, the proportion of cases that have severe disease is about half of what Delta was. So it doesn't cause as much severe disease for those that are infected. The hard thing is it means, because it's so contagious, there's a lot of people that are infected. So that's why in Palau, we are working with the ministry and really preparing for the worst when we're looking at the numbers of Omicron, but of course hoping for the best. This virus has moved so fast, it's really hard to get good data and perfect idea of how it will roll out in Palau, but it is moving fast, and so far there's no one hospitalized, but we find that those come a bit later. But that's why it's a variant of concern. Vaccines are still effective at preventing severe disease, especially if you get a booster. So again, encourage everyone, especially those people that are high risk, people that are older, have diabetes, hypertension, they're at higher risk of severe disease. So if they get a booster, they're going to lower that risk if they get Omicron.
I just would like to add one more thing to that. Thank you for that question. And one of the things that your question highlights is where you get your information. Clearly, you are looking at the WHO website or the CDC website to learn more about Omicron, which is affecting the community. Very important not to listen to Dr. Facebook, we say, yeah? And to get your proper information from the ministry, from reputable websites, and try to avoid the very tricky misinformation that can really cause damage in the community, leading to more cases that would be unnecessary. So thank you for doing your research and going to the right sources.
Sulange, Minister Erbelau. Aldilongile, Kukera, Gerel Mora, Tikal Toktang. Dr. Rostrom, as far as helping control the spread of the disease and the contraction of the disease, for us in the States, we have public places in Palau, all of Palau as well. Do you have any recommendations? For example, people who go to parks, public places, is there any advice or cautionary instruction for those areas where people go and congregate or spend time, and as far as contamination is concerned for spreading after they leave the place? How safe or how not safe when other people go, as far as touching the benches and things of that nature? Can you explain how risky or make any recommendations to protect spreading in public places?
Thank you for this question, and this has been a topic of great consideration for the committees, for our work side by side with the ministry, for the former ministers as well, for the president. We've discussed this at length already. And first of all, the recommendations that come out are changing all the time. So even though, as Dr. Hancock pointed out earlier today, it's important for the health department to make the best recommendations for the community. And sometimes that means things will change as the virus changes, as the virus activity changes, as you go through this pandemic, there will likely be some changes. The recommendations for Palau are not considerably different than the rest of the United States. I think, and they're the ones that we have discussed already about getting a booster, particularly if you have any risk factors, you're over the age of 40, but for everyone, really, if it's time for your booster, please get it. It's not too late. It's really important to get your booster. For people to stay home if they're sick. This isn't the time to go to work if you have a cold, or send your child to play with other kids. School is canceled, but you don't want to expose others if you have even a mild illness. It's important to wear a mask around others, and these masks are uncomfortable, and it's not a lot of fun to wear them, but it's really important. It's not forever. It's maybe just a couple of months, we hope. So, but right now it is important for anyone to have your mask on when you're together. It's important to avoid crowds, and especially if you can, be outside. It's to have activities outside in small numbers with masks on. And I think that's relatively safe. If you're outside and there's a little bit of distance, so people can get together in smaller crowds with a mask on outside should be relatively safe. And then the last thing I just wanted to say is to not be afraid. Instead, to be smart, and we shouldn't let panic or fear make decisions. We know that it's so important for Palauans to get together as a community, but it is time to make those gatherings small, have them outside whenever possible, and to wear the mask. You have more for that?
And just to emphasize for those, what we're finding more and more is that this virus really transmits easily in indoor areas with poor ventilation. And it's through, spray from your mouth within 6 feet. And there is some virus that gets floating up in the air. And if it's not outside and blown out, you can then inhale it and get infected. Early on in the outbreak, we were really worried about touching things. But we found that the virus does not last long on surfaces. That is not a major form of transmission. So if you're outside and it's a railing outside in the sun and somebody touched it and you come by later and touch it again, the chance of you getting infected is very low. It's much higher if you're indoors without a mask with poor ventilation.
Delegate. Level po nga delegate ka na.
Ngilitasil sa minister ma-klay marbeklaan. Minister ang akum das ko naman namo ko ra abato ka do tengeli kel koramle era ngudari. Minister bang ko ra karikal ika kitam lamit lo bente adar olbil tamal ne concern kirela public education ma awareness ang ko ra karikal wasay. Well, our governors ang artiang, our speakers, mikitang artiang rokui. Ang korang dissemination or information, alway kay give toreng sertikal toktang, elang malube, ang gamiul expert tarato rahel, el morapuay. Kamkora di mo oti segit al siyasing, maradal moreng sertiang al bola ansing alwase, ebol maklarandir, alwaseng, nangyari adal di akal TV, ngaway, malubeng via loreng sa radio ngora wangara segi del implementation na plan na kaora a disseminate all information and more abuay so lang yung minister
Sulang delegate mal tiamal qura amre edel togol la dasis balsel umral qura talgib al mayo da qura dissemination public education Gibreng asulir adra office of president lo ngasir kamamara gaygi del qura posters ma qura graphics sa mamal direct lo spell mort dirigel ngaringa internet tir maro Facebook social media hindi agi mamongot mok karinga bekkel kop singera 6 ya kuk otobadi updates in mara adra blue o sisita may gel talk show malmol ngaringi so mam ngoy titri tirgagi dil el sembong toktangan mo makada teal ngani ager mangir of course ay mo to daragal kakaros el media outlets akum dasing adya ka raada ma time sa edel qura marula qura town hall hindi adi mo gaygi sa edel di through media of course adra Palau Media Council direct sa amal qura marula briefing lo bantarir mo gi diolingi ta sebol klornira adra blue agim mula sa malol re adolor to bada gaygi dil kakarosil information yun lang.
Sulay minister tial kariga arada amo madaktalo geringi atiri lo geringi di ngakamo o geringi sel mle report al multo badi amol korgi dal waseng tial rak takot tal abunal ngasar dirakal vaccinated mar mawod mar mga niya raktir mga niya sel part tal masawa dari wase smoking kita madingan wase ngariya adal malok atol mar malok marijuana mar malok atyang BSL teletal ra umlok tele vapor ang vape ang rangklel mar mange Again, fall under tial smoking. Siya ko adi garig lang mal beto kar adalos pa ay gid klalo ul mo doke. Eso direct question ar baby ar admong ul makpagyo geringi. Sula.
Sulang delegate. Kau ko kel wase omlokol dokol ma kukigil baby aloloko. Ngaringi TLL moklo adal moklo TLL adal ngumal ubam media rakta sugum tablok atol orang sugum smeere emelok atol
minister ngarse report el blem provider el mera other olbil el qora lu gele lista other malmo smeer sel ngutya rak adal dirakal vaccinated, mar miitut, mar ngariaraktir, ma direct kalwan na lista, mlara bullet point, smoking, or other smoke. Aul makadogel was I saying, when you mean smoke, I'm clarify smoking. Smoking, alcohol, ay galaw nicotine, marijuana, vapor, direct trikal mange, trikal siguro include as I say. Kora question or other abulu, mung sa daloger ngi, so other clarify ngi.
Sulang. So the question is, in our messaging before, it used to say those who are high risk of severe disease include those who are smokers. Is that still the case? And perhaps also those who chew tobacco with betel nut, is it the same risk level as before with the previous variants?
Hello. Yeah. So smoking is a risk factor, and so when you're inhaling tobacco or marijuana into your lungs, you're putting your lungs at higher risk of infections, and that includes COVID-19, all variants, including Omicron. It does look like across age groups, across vaccination status, across risk so far with Omicron, it is less severe than the other variants. But it's still, you're still higher risk of having severe disease if you're a smoker. I do want to bring up, I don't know if folks recall when I was here in August, we talked about a therapy for people that are high risk. If they're positive for Omicron, they have symptoms, not Omicron, for COVID-19, and they had symptoms, that there was a therapy available called REGEN-COV, a monoclonal antibody. And unfortunately, that antibody is targeted to that part of the virus, the spike protein, that Omicron has changed and mutated. So it doesn't work anymore. But there's another antibody that is being shipped in, monoclonal, by our two colleagues here from ASPR are working hard to get it here. It's called sotrovimab, and it does work for against Omicron. We also have an oral medication from Pfizer called Paxlovid that is also on its way to help prevent, that you can take orally and help prevent severe disease. And why I bring that up is if you are high risk, if you are over the age of 65, if you have diabetes, if you have obesity, if you're a smoker, there's a long list, and you get Omicron, you get COVID-19, know that, hopefully in a matter of days, we'll have some treatment that's available that if you come in early, you have to come in early. It's not something that you wait till you're really sick. You need to come in early when it feels mild, and you get this therapy, and it can reduce your chance of being hospitalized, depending on the treatment, between 70 and 80%. So it's another layer of protection. The thing is, as I mentioned, they're on their way. As you can imagine, across the U.S., there's high demand. So, we're not getting enough to treat all of Palau, but it is on its way, and it will continue to come. But that's another option that I think it's important that people who are high risk recognize and know about, and work with your providers if you do test positive to see if it's available.
Sen lager level atakol tol belal wase mo loko yung tara risk factor whether kamlo dako lalu kamlo marijuana malumi kale pipe hindi gel dilu gel toktang adilu wase ndal salmal mohido ya sadel olmedem lengul tursel tol guktilia Dr. Robert wase kal Omicron elertial upper respiratory system. Ndakal borserium, ndakal sal mohido pneumonia ni. Hindi kal dilo lo sa isel ngani ayel karal dolim. El gukman le atter ngel delta variant. Leng le target ayel tadel el waya tadel aibul. Le senga ba bargar del ibul leng le target ayel bargar del tendel. Hindi ngayi del Omicron amle chance seguir del bargar del tendel guk mongoda iroringi mayen legar luror la delta de luror Omicron dinga yegel besel gar el mel tania de Paxlovid ayegida amral me ayegida guk target ra Omicron di dolim sumo mosme nda magirem el mingil ngirem el mem tamre del masqaw man da bom nuyi mal salmo hido ertem sula.
Oye, minister aku akora orang sa aldadu mau merar sil tokol lol korngar beklat wasing kadabelu rogir ma leadership tial belawe et makal kay ngase tial talitan mak lamam dengel wasi sel closing ra school 1 week ase kita trial gura madrobra spreading mendiakal mered mak question orang kawasal sugum seguida ka all the sweat el mre del wado stobra spreading ya consideration ra se may closing ra government agency sa king sing help al upakad mamdas ring ruriu lang di aku marar kami ulasing namogira del tekay del lombru stobra tial mal del spread. So if we were to stop tial del spread ya a consideration ra semi-closing. So when I say semi-closing, la di tirgel designated del adal en sira dengwa alway gel kura essential services ay kaya offer. Hindi sum tiaway segi de akura hasel sum kada maral serious en sense del consider ni malu msulang.
Msulang Rolida. Oisa agi malmol melorio lo menteri tirgal toktang. Omesra tetele la rakta. Sukum umral moptoka atal mesois el malgora opting la raktir, mering la raktir. Maluba hospitara mal moptoka atal mon yuing la COVID aul. Of course hindi akal suad el mangin morsay. Magidi orio lo menteri lo mesa oul. Sukum mal mo gidad el marsay gidil wal phase 3 at omesa sel planner gidil ang phase 3. Yang sebaet el morsay gidil. Of course, setia to tingil setia di hindi ka tal sander at Allah ka daw mask ilan tal sander uri la ka damla mo mategil ng aringim sa el di kluko kung kukmongot at tokoy magiti olingit la se di da kay ngasel marula gel kira ta marula el alta mal sumung kluko kay mongot ay kuk mutel oto da kuk PS el mandate tamalung regulations sila sa kada makaram. Hindi at time sa igid. Kung tutela la igid preventive measures. Ya omrus sa di malmol tugtakan mo mala orus. Unfortunately sa igid ya reality ay galo kul plan igid am lertura igel previous variant. El taligib el mayo del loberga. Tiang amal wal kura Udah ngau di mail merail, mendirek kel mering kita, omda seseguk ta masih menurul sandeng, guk ngarang to melil mora ka krusul. Direk kel to mesringin dia kal sal, to kal adam la mosmer malub dia kal tingil set na mosmer. Magay kita ka gira del kora omes mo guk malib lo sekal mo badul ke. Nding meral wa sel, sukum gira del morsegit ka del morgi. Deliga tabli. Ang silang ya delegate. Oh, magsubay sa itong alas talgar kung wala mo ka mga tatay makatugok mo Pediatric. Talibral po nga inaboy Senator Mansal.
Sulang minister milita silsa. Minister ang bato kara adal mal concern giri rangal ka tirgal orus matrigal miyakarel 12 April medio ma kulingit talwase pod sa tirgal toktang al kora o ay sergi talwase selbol al sukumangal ka moringi tiarak tengkura ngura mo wangaranga atetelel wadi mo sapira our parents mo understand del wase ngarato kora o meseringi al sukumangal ka mosmer ongerul questioner nga adik tungay ka dito question nga ongerul question nga kay minister Agire la se corona close sa hospital. Kita material guk di kalse terak tanding guk ngaringangot raktirang aku ni tulah sebol sepemel mora o ay selo semang kotokoram karang al sumong korang ngaringia emergency. Pwede mo explain el mora adra blue. Sulang yung minister.
Sulang era kuiwalin mora tigal toktang. Hospital ada kal close hindi emergency room malmol agel kukora clinic sa NCD gigi dia to kora mo omes lo sem makarado o kota meluk kal mora tarabasyo mong roy dari na hospital o sisit time kota omes sem makarado tergibel mga sa landing hindi kal stop makpayo langit tra tirgel rogul patient la sem mo makadong ra toktang rakaw mo makadong mera hospital mo madingi gen muin details sa gigi mo changes sa service sa gigi di kluktel mo kataklir sa ngomu red algop singe dia ka oding ro hospital adalo laba aklakdalan mo ra newing adi mo sa gigi yang anyar adalo laban mo ra alsila word Dr. Tain, the question from the senator is regarding children who are ineligible for vaccines, so younger than 5 and perhaps even those 5 and older who have not been vaccinated. What is the general sense of severity of disease when they get it, when they become infected with Omicron?
That's an important question, you know, and I think throughout this pandemic, the fact that the vaccines weren't available for kids right away, and that's kind of unusual, right? It's different from most of our vaccines we give to our kids, and I know it's been very difficult. As a parent myself, you know, I was looking forward to vaccinating my 9-year-old, and I'm looking forward to the opportunity that I can vaccinate my 2-year-old. Even though, fortunately, Omicron and COVID-19 in general provide, if, you know, when they infect kids, the chance of severe disease is extremely low. It can occur, but it's extremely low. And we're still learning about Omicron. We're not sure if there's other things that, you know, for a child that's infected, if there could be other things that impact that child. So in general, unfortunately, you know, the vaccine now won't be as effective at preventing them from catching Omicron, but it will enhance further and lower the risk even further that they have severe disease and have to go to the hospital. We found that. So even though it, again, is not as good at preventing that infection, the improvement of, or the reduction of severe disease is the reason why I am happy that, you know, my son has been vaccinated against COVID-19 and look forward to when my 2-year-old can be vaccinated as well.
So again, their children are definitely getting Omicron, definitely getting COVID. We have children already that we know are positive. So it's unfortunate that they cannot be vaccinated, but there is some reassuring data that we have already from CNMI. They are finishing their Delta wave. Again, this is a different variant. But for example, there's now I think close to 4,000 cases in their wave. And there's one patient that has, one pediatric patient that was admitted to the hospital. So again, it can affect children. It's serious when it does, but most children do very well with this. They are vaccinated pretty well, just like you are. And that should really help. But for those who can't be vaccinated, as Dr. Hancock pointed out, it's often a very mild illness.
But in general, too, with Omicron, one thing that they're finding with the hospitalizations is that the duration of the hospitalization. So even though there's a lot of mild illness, there are a number of folks that require hospitalization. But unlike Delta, those people that get hospitalized with Delta, there was a large proportion that required ventilators, and they stayed in the hospital a long time. Omicron, the average hospitalization day coming out of South Africa at least, and again, we're getting more and more data, but it's about 3 days, so it's shorter. And we expect that, for kids, those numbers would follow as well, that if it is mild and they're hospitalized, it would be a short one, we hope, but,
Global gula doi diesel en ger girar ngal dirga kalanga yobo. Trigal tokta se a COVID in general, a gerogul variant from cell wild del COVID, alpha, beta, all the way melmera omicron. Digal salhido arbora ngal. Togunin gayi del omicron kal tomda so sengari belau. Mal ngario gel wild symptoms ringil dosising mar adults. Ya makasartir amon newing, trigil mon newing omsin dra time, in diabolos pe igel mal kora itito ol mesin. Sulang.
Senator Ramoso.
Sulah minister amal dia rulger nara balul me. Akote telgera medal mo igel na concern na deligat rangar along. El melbade baklo ase el al loral mo. Tiarak tal adi maral mon mo betul apa baldaw. Kadam dengi serat temela dengi melarga igel effort tergi del goram le identify belum malum pasol ngia para klorak tergi ngumlornya wakin rohosi. Saya gitu loh susu teletal ng asap edel aplaringin merti ay gidel rakter el aldo dengel wasen di merol ngar belau ngaray gay gidel goram mo measure selungil bodotega sum kadam arse gid. Ongerung tia direct logit temnar parents el may maldi مساعد الجير العوائل التايم البلاد دورا نالغرا سكول وسن دخل برا سكول غادي نالغرا دايجير دخل الما دايجير لين قدام تنجي سيتويشن الدنغرا السيل غادي اقول دسويلا كلول قبل بنت القرا موسيل موسوتري تريجي دل بارنتس التيرا التايم guardians تيرا التايم غارا بلايل دخل لورور او مستر نالغ التال ساندي مايكل غارا التايم من المي سلام
Silang senator ang laadis ekal mo onger sa lukot talgir. Agi umdas sura sa al-tay may gagi di preventive measures applicable marukulat. Unfortunately, hindi kalsal sa baed alam kasi tiang mura dengue fever, la dengue fever moyul true rakas. Masilbo do clean ng mo dia karkas sa gidi oliul tiang tial rakta at mura at mong giredan mo malasam sa baakring gigi tilat mong waigel dilung igel ngeral mora delegate kanay selbol time giredan ko marula astob omrael malubak damang sa dala biset emro ko kuk mor sa gigi time hindi ka tomera adal dingil kuk mo dingil sengarnya wodal ngarablim malubang molding ringi la ka molding ringi telal Sunday kuk desatyal ndakadongi rakabal mental mo ay sirgal sa morula gel girem morul embo moruli segi dia giredel lolingi tanira adrablu wase dilgi de lomes gel sa edel gut mokla da gut mok malbol salba akla rugulat selong erul gera la takal sal sa eklong ngil wase ngania kuk ngesol mora ar adal mo takal sa biir el moriol letam o mesarang ligir umdasen Kira mora tara ministry. Hindi kung dasang dakat sa amar kuk ministry ra handle masata stimulus and mora parents. Tegi da momong mo lobong alger atang.
Komeng nama waktu time gugere tira kerja kerja tiada du era apa waktu time di Aku na obesin. Tiga gider ngara online mal atau maklat keranga. Agera wasei. Yang kokora yang toreng sergau el ministerio wasei go encourage al adel momra orus. Tiar ker girir tirar orus rangalga. Tiagora moli leiten mora la. El stera mkotol marusa rangalga. Tirigel mora 16 years, below 18. Algo require tirigel dibusa de merir maderril. Yung angalgira oba grandpa, grandma, maluba auntie, maluba sister. And algo require documented more alter was saying guardians. Mang temre betogol grandpa, grandma, omlo kotowarti, mga tarti. Mre 2 times ak meras, hindi ngergega ngaramrige. Hindi akadamar. Nga single parent. Makmarusel mong gilil mo magsawabiel me. Ak mleche kara korto asing ki aiga gilil akeisen. Ngarbora akeisen mo magteg. Maktraria second time in dia sebel. Mel ang dirgo waisay malubang eral nasois ba kay do Omicron. But I assume it was saying ngaringia hook other than Omicron. And require abang mga vaccine. Dirgo marumol man mga luwal yalla malubang tergibel ben teringim sebil loguil ngalagal momra olos. Sige demro sulang.
Mensulang ramalungil gere. Moisay gukmle advisor adra la al merkamamo asel sukumong minor tiaka la al sebil sob akling gay den minor. Hindi dito malara consent ra parent mo. Tokora la hindi kita meninggal sing or udel tokora held. Maka ulingit ta sebil ma mo tara time mo pada adu il asa ito ulingit ra vice president ma direct kal adra olbil mo pada message sa igid lo se adra la lo se makara to sob akling gay wait yang pandemic lakad sa ilmo urus landila au. Sulang. Akum daseng ana mo ngila katamal ko rama katatal dang okla madilungil sam sim ngania ko ra last del soril malkoy trigal terul toktang di voldung marko poto sim direct kal ngania talk show ra kapsengay mesel update tagi mo maruringi may gel hotline number sa malmol mal open so ngania ko keren mo dakat sa etlongер el chils. Mataloy se speaker ala ka ngot al somin ko ma president ta senate. Taloy se ko man masulang kumda se mal to ka sa edad smarter ilang. Ito lang ito se el al loral marpa bagais ada kal se edal mut el meu meeting el watyang yung kuramu ta kal lungi la to tolkor adra pelulu se dong roy ter kita rat kita the leadership mem dong ok roy circle tertela time undas so annex el se petel kora sugum mal ma agi detro meeting eto undas ra kuk tara tele la meeting rigi dal tan se etel mora pasyon ngarik mal ubo ko mora zoom endi aguling ito sel kal maral mele rule sunday kuk to masada lagi agi del kuk mal kora maklo londi bladang koman mesulang Dios lo makantangat ter gidro ko.